A very good evening, everyone. This is Dr. Azam here, your faculty of anatomy at Dr. Tutorials. First of all, I welcome all of you to Dr. Tutorials platform here, sir, on YouTube. And as we are actually going through this series of Clinical Thursday, so this is the time that we are going to discuss about the clinical conditions in all the subjects, like various renowned faculties throughout, national faculties have already taken like many sessions on our doctoral platform here on YouTube. So today I'll be actually discussing one of the very important topic in anatomy, clinically very much important. And they're actually asking like many questions from this topic many a times in your exam. So, and whether you're actually preparing for your NET PG exam or INA set exam or the FMG exam, like many a times, extravasation of urine. They're asking the questions from this topic here. Fine. So today we're actually going to discuss about this one in detail. And I'll tell you like how to solve the questions exactly if they're giving the clinical question in the exam. Even in fact, recently, like FMG exam was conducted on 30th July. FMG exam was conducted, and in that FMG exam also they have asked the question regarding extravasation of urine. So this is like one of the most important clinical topic right now. So let me discuss everything regarding this one. Fine. Now, before telling you about the injuries to the urethra and how the urine will be extravasated and in which parts it will be extravasated, first let me give you an introduction regarding the perineal pouches. If you have a clarity in the perineal pouches, then you'll understand this topic much more easier rather than just mugging up, okay, like what is getting injured and where is the urine going and all those things. Okay. So what I have observed during our live classes, like face-to-face classes, that most of the students don't have a clarity regarding the perineal pouches, sir. So let us actually first of all discuss about the perineal pouches. Okay, I'll just tell you like a little introduction regarding that one, whatever is required here, and then later on we can see about the extravasation of the urine, sir. Is it okay? Yes, thank you. Okay, Dr. Manan, good evening, Dr. Manan. Okay, Ji. So Dr. M, I think first of all, I don't know what is your name there. You're writing there as Dr. M there. Nothing came from the notes in FMG. You people just making money from the innocent FMGs. Oh my God. Oh my God. Fine. So let's go ahead, sir, without speaking much on these negativities and all. You can actually go back and check the notes and everything. You can attend the lectures properly, dear. Then we can have a talk of that one. Okay. Like there were so many questions asked in the FMG exam from the anatomy. Like we have discussed about Perineal, extradural hemorrhage, middle meningeal artery, then the nerve supply to tongue. I said you definite question will be coming from their anterior 2/3. And then there were so many questions regarding radial nerve, wrist drop, the nerves related to humerus. And I can keep on saying so many of them, like almost like 18 to 19 questions came. I'll be discussing that in the recall session. Don't worry. Okay, fine. This is not the place to show your negativity, sir. So let's have a discussion on this one here. Please, I request all the FMGs to attend the complete classes, and then you can obviously able to deal with this kind of questions, guys. Okay, I can understand it was a little difficult question paper. Yes, but at the same time, yes, just the rapid revision sessions and just those one-liner and those chanting are not at all going to help you. You actually have to attend a complete class to understand the concept and answer the questions nowadays. We have discussed so many questions like, great auricular nerve, this, that, and all. So many questions came from the notes, sir. I'm extremely, okay, let's not discuss much about that one, sir. Fine. Hello, Dr. Manan. Hello, Parishma. Hello, sir. Chaliye, sir. So let's get started with this topic here right now. Now, first, jaise maine aapko kaha hai, sir, first of all, let me first of all give you an introduction regarding the perineal pouches, and then we can actually learn about the extravasation of urine, sir. Now, first, look at this diagram here, sir. In this diagram, you're able to see the sagittal section of the male pelvis and the female pelvis. Good evening, Dr. Vandana. the sagittal section of the male pelvis and the female pelvis here. Okay. Now, my dear doctors, first have a clarity about the pelvic diaphragm and urogenital diaphragm, sir. Okay. Pelvic diaphragm and the urogenital diaphragm, guys. Okay. Yes, of course, Dr. Manan, this is very much useful for the NEET PG. Already questions have come from here. Okay. In your NEET PG in 2022, the question was asked. Last year only, the question was asked from the extravasation of urine. Okay, fine. Now, the male pelvis and the female pelvis. Let us first take up the female pelvis over here. Now, what I have observed here. Yes, of course, Dr. Faizi, this was asked in the FMG July 30th July FMG exam, just a couple of days back. This was even asked in the FMG exam also. Yes. Now, first of all, my dear friends, let's have a discussion regarding the perineal pouches. Now, before that also, like one step back, let's go one step back here. I have seen like in the face-to-face classes, regular classes, many of the students don't have a clarity about pelvic diaphragm and urogenital diaphragm, sir. Pelvic diaphragm and urogenital diaphragm, they don't have a clarity. So what is that one here, sir? First, in this diagram, you're able to see here that these muscles which are sloping down from here, sir, these muscles, and that muscle is actually together going to form your pelvic diaphragm. Okay, I'm not going to go into the detail of all these things. Let's not deviate from our topic right now. So this is your pelvic diaphragm. And this pelvic diaphragm will be having only and only one opening. That will be the opening for the anal canal. Similarly, you also have the pelvic diaphragm in the males also here. This will be the pelvic diaphragm. And yes, of course, there will be one opening here for the anal canal. It is made up of those two muscles, levator ani muscle and the coccygeus muscle. So that is a pelvic diaphragm. If this is the pelvic diaphragm, then what about the urogenital diaphragm? So let's see again the same thing in the female than in the male. Now, in this diagram, these muscles over here are together going to form your urogenital diaphragm. So this one, urogenital diaphragm. Now try to understand from the name itself, this urogenital diaphragm is the one which will be having one opening for urethra, and there will be a separate opening for vagina. There'll be opening for urethra and there'll be a separate opening for vagina. That's the reason why doctors kept the name as urogenital diaphragm. In the females, we all know very well, there'll be a separate opening for the passage of urine and there'll be a separate opening for the vagina, the urogenital diaphragm. But similarly, in the males, if you observe here, let me remove this. Yes, there will be a urogenital diaphragm here, but there's a difference. In males, you'll be able to see only and only one opening there. One opening for the urethra only. Okay, that's how you can easily differentiate the urogenital diaphragm in the male and in the female. Is it okay? Why? Because in the males, you know very well, urethra is the common, passage for both urine as well as the semen. Is it okay? Yes, of course, Dr. Anwar Hassan. Yes, I'm actually live from here. Now, my dear doctors, if once you got an idea about the pelvic diaphragm and urogenital diaphragm, I think now, ab yahan se, agar aap diagram dekhoge, from today onwards, from now onwards, if you look at this diagram of the male pelvis and the female pelvis, I hope you will be able to differentiate the pelvic diaphragm and the urogenital diaphragm. So, what the clarity? Now this urogenital diaphragm, it will be having one fascia above, and then there will be like one fascia below. The fascia above here will be the superior fascia of urogenital diaphragm. I'm telling you a little bit slowly here. Try to understand very clearly. I'm not telling superficial fascia. I'm telling superior. Okay. Most of the time we have a habit of listening to that one, like superficial. And even if we are writing in that manner, SUP. So बहुत सारे students वहाँ पर ना during the class they'll be writing as SUP and they'll be learning that as superficial. Be very careful there. It's not superficial. It's superior fascia. Superior fascia of urogenital diaphragm. Similarly, you also have inferior fascia. This is the inferior fascia of urogenital diaphragm. And that is also known as the perineal membrane. Perineal membrane. Similarly, in the males, let us see here, there'll be superior fascia of urogenital diaphragm, and then you'll be having the inferior fascia. And the inferior fascia of the urogenital diaphragm is also known as perineal membrane. That word is very much important. Many of the clinical questions are even asked based on that word, sir, perineal membrane. So let me do one thing here, sir. Actually, this diagram here, it's actually the complete diagram of like male pelvis and the female pelvis. And from this diagram, let's remove the urogenital diaphragm. Chaliye isko remove karte hain, sir. And once you remove this out, this is how the diagram looks like. This is the urogenital diaphragm. And now, whatever I told you, sir, based on that, you'll be able to easily differentiate. Can you just look at the diagram and tell, okay, which one is in the female and which is in the male? In this diagram, the diagram above here, this will be in the female. You are able to see one separate opening for the urethra and for the vagina. Similarly, this one will be in the male, sir. The urogenital diaphragm in the female and the urogenital diaphragm in the male. Is it okay? Fine. Now, again, the same thing, you're able to appreciate the fascia above. This is the superior fascia here, and the fascia below, that is the inferior fascia. And as I told you, this inferior fascia here will be also known as what, sir? The perineal membrane. Is it okay? Yes, yes. A very good evening. Very good evening, Abhiram. Very good evening, Chaudhary ji. So there'll be like two fascia, one above and one below, sir. Superior fascia, and then there will be inferior fascia. Inferior fascia is also known as what, sir? Perineal membrane, sir. मैं आपको ना बार-बार कह रहा हूँ. I'm telling you again and again. Please keep this in mind, sir. There were questions asked based on that one. I'll tell you at the end how they can frame a question based on that one. Now, similarly, in the males also, you'll be having a superior fascia and then there'll be an inferior fascia. So, fine. And now, my dear doctors, let's come back to this diagram again here. Now, in this diagram, yes, you're able to see one superior fascia and then there will be one inferior fascia. And yes, inferior fascia is also known as what's the perineal membrane. And apart from that, once you come outside here, of course, in this region, perineum region, you're having skin. And just below the skin, as a doctor, we all know there will be one more fascia, that is superficial fascia. What is that one? Superficial fascia. And that is also known as the Colles fascia. इसको हम Colles fascia भी कहते हैं, ठीक है ना? So now the concept is like so easy, my dear friends. If you just come from inside out, there are like three fascia. Just look at my hands here, sir. Superior fascia, and then you have got the inferior fascia, and then there will be the superficial fascia. Here, common sense. Agar teen fascia honge, if you're having like three fascia there, how many pouches do you have in the middle? There'll be like two pouches. Hai na? So just make it like very crystal clear. So simple in your life. Don't try to get complicated. You know, students are like mugging up all these things and they're just making it very much complicated. Itna zyada kuch complicated hai nahi sir yahan par. It's nothing complicated there. For example, if this one here will be the superior fascia, I'm just drawing a schematic diagram. Agar maan lo ki this is superior fascia of urogenital diaphragm, and then you have got the inferior fascia of urogenital diaphragm. और मैंने आपको क्या कहा था? What did I tell you, sir? This is also known as perineal membrane. This is perineal membrane. And then finally, there will be superficial fascia. Of course, the superficial fascia of the perineum. And this superficial fascia of the perineum, it is also known as what? It is known as the Colles fascia. इसको Colles fascia भी कहा जाता है. And that's what I'm trying to tell you, how to make this concept easier. Just we are having how many fascia there, sir? Three fascia. और अगर तीन fascia होंगे तो इनके दरमियान में, in between them, how many pouches do you have, sir? How many perineal pouches are there? Two. And of course, the name of this perineal pouch will be, this will be the superficial perineal pouch, and this will be the deep perineal pouch, sir. So the one which is present here, that is the superficial perineal pouch and the deep perineal pouch. Makes sense. So if you just remember the simple diagram here, sir, like a line diagram here, this will make your life easy. 3 fascia honge or 2 pouches honge, sir. Now, welcome back to this diagram here, sir. After learning this one, sir, let us just, that was actually our line diagram here. Let us just again, in this diagram, let's try to mark. Yes. What is this fascia? What is this perineal pouch here, sir? This one will be the superficial perineal pouch. And this one here will be the deep perineal pouch, sir. This is your deep perineal pouch. Make sense? So there are like three fascia, and yes, there'll be like two pouches. One is the superficial perineal pouch, another one is the deep perineal pouch. It makes sense now? Now, after this, now my dear doctors, please shift your concentration onto the male urethra. Now let's come to our topic right now. So today's topic, male urethra. Everyone knows that the male urethra will be approximately 20 centimeters long, and that will be actually divided into like three parts here, sir. This one here, which is going to pass through the prostate gland. The male urethra, which is going to pass through the prostate gland. This one will be known as prostatic urethra. And then this one here in the deep perineal pouch. In the deep perineal pouch, that is known as the membranous urethra. And after that, this will be in the bulb of the penis. This one will be the bulbar urethra. Fine. So everyone knows that the male urethra will be approximately 20 centimeters long, and it is actually divided into three parts: the prostatic urethra, membranous urethra, and the bulbar urethra. ठीक है? अब यहाँ पर होता ये है कि this urethra will be actually ruptured. Okay. Now in which conditions? That's something very important. और मैं आपको ना वही तो बताने वाला हूँ कि in clinical questions, how can you solve the clinical questions in the easiest manner? And you people just recall and tell me what was given on 30th July. Okay, 2023, that FMG exam was conducted. Okay, now, and I'll even tell you what was asked in the NEET PG exam also last year. Is it okay? So there's one keyword, sir. अगर आप वो keyword याद रखोगे ना, बड़ा आसान हो जाएगा. It will become a little bit easier for you, sir. Now, first of all, my dear doctors, remember, in the clinical questions, they will actually mention you. There will be a word given that there will be a pelvic fracture. You have to search for this one, sir. Please write down this in the bold and capital letters somewhere. Agar sawal mein, in the question, if in the question pelvic fracture is given, agar pelvic fracture hua hai, there is a fracture in the pelvis, then remember it will be leading to the rupture of membranous urethra. It will be leading to rupture of membranous urethra, sir. This one. That's something really, really important, sir. So, agar ye sawal aapke exam mein aayega, if this question comes in your exam, you need to search for this word in the clinical question. Definitely, they will mention this one, sir. If the pelvic fracture is given, then it is definitely which urethra ruptured, sir? Membranous urethra. Membranous urethra is ruptured, guys. Okay. And the second thing, suppose if they are going to give you this word here, if there is a straddle injury, if there is a straddle injury, sir, agar ye word aapko nazar aayega, if you are able to see this word here, remember it will lead to the rupture of bulbar urethra. Yes, these are the two golden words which can fetch you marks in the exam, sir. आप फटाफट आंसर कर सकते हैं, sir. Less than 1 minute. In less than 1 minute, you can answer the question, sir. If they are giving pelvic fracture, read the question properly. Whatever 4-5 lines are given to you, if there is pelvic fracture, then it will lead to what, sir? Membranous urethra rupture. And then straddle injury agar diya gaya hai, that will lead to bulbar urethra. Now, straddle injury, aapko pata hi hoga. I think you know the word straddle injury. Aapko ye word pata hoga ke, for example, a boy or a person is riding a bicycle, sitting on a bicycle on a bumpy road. Okay, no, riding a bicycle on a bumpy road, sir. Okay, no. Normally, like you can see nowadays, we have this rainy season, और अक्सर यहाँ पर roads हमारी खराब हो जाती हैं. So suddenly, what will happen while going on a bicycle, there will be a bump. Okay, ना? वहां पर जैसे हम लोग हिंदी में बोलते हैं गड़े खड्डे होते हैं और अचानक से साइकिल आपकी खड्डे में चली जाती है. So then what is going to happen when you are riding a bicycle on a bumpy road? Then what is going to happen? There will be hit onto the perineum region और ये rupture हो जाता है. So remember what is going to be ruptured? Bulbar urethra. Yes, of course, Dr. Faizi is telling here straddle injury was mentioned and bulbar urethra was ruptured. Yes, of course. So इसीलिए मैंने कहा था ना उनको. You can see there. Yes, one of her friend here, like she's able to recall the question given in the FMG exam. Yes, it was straddle injury mentioned. तो मैंने क्या कहा? This word you have to catch there. अगर pelvic fracture होगा and जैसे आपने मुझे कहा है FMG एग्जाम में straddle injury दिया गया था. Yes, last year 2022 in the NEET PG exam, yes, they have mentioned pelvic fracture. You can go back and check the previous year questions. Is it okay? So pelvic fracture word is given, membranous urethra rupture. And then straddle injury agar diya gaya sir, bulbar urethra. First thing is that one. That is the reason why I am repeating it multiple times here, sir. 3-4 times I'm repeating you. Ye bahut important hai. It's like the golden mantra. ठीक है ना? Now once you know this one, अब हम सीखेंगे. Let us try to understand कि अगर ये rupture होगा तो यूरिन कहाँ जाएगा? Where will the urine go? Make your life simple, crystal clear. Understanding? So let me take one by one, sir. Now first let me take the pelvic fracture one. अगर pelvic fracture होगा, if there is a pelvic fracture, then which urethra will be ruptured, sir? Membranous urethra. Please keep on answering me there in the chat box. Okay. If pelvic fracture will occur, which one will be ruptured, sir? Membranous urethra will be ruptured. Okay. Now, what is going to happen? The urine here in the urinary bladder, instead of going out through the urethra, yes, sir. Thank you, Manan. Okay. Yes, instead of going out the urine, what is going to happen? It is going to extravasate out. One thing that you can tell me, आप मुझे बता सकते हो sir. एक चीज जो आप मुझे बता सकते हो. Yes, the urine will be going out in which pouch? What is this pouch? अभी तो मैंने आपको सिखाया था. Just now I taught you. Which pouch is this one, sir? Deep perineal pouch. Understanding my planning right now? That's the reason why I told you about the perineal pouch, sir. Now, many students, they don't have a clarity about the perineal pouches and directly they want to just learn the clinical thing. Is it okay? Directly they want to learn about the extravasation of urine. Nahi samajh mein aayega bhai. You will not be able to understand. Understanding? So first have a clarity regarding the perineal pouches. Yes, very good, Dr. Vikas. Very nice. Very good, Manan. Hai na? The urine will go out in the deep perineal pouch. Very good, Dr. Faizan. Very nice. Hai na? Apart from that, what else can happen? Yes, one more thing is the urine can also go into this space here, sir. Again, if you are able to appreciate this space here, sir, this space will be the space around the urinary bladder. And that around the urinary bladder, that is nothing but the paravesical space. Okay, na? The paravesical. Urinary bladder ko vesicle bhi kaha jata hai. So around the vesicle, around the urinary bladder, paravesical space mein bhi jayega. Apart from that, what is the space behind the pubic symphysis? This is pubic symphysis. What is the space? Isko hum kehte hain the space of Ridgius. Okay, retropubic space. Retro matlab behind the pubis. That is the retropubic space of Ridgius. Wahan par bhi jayega. So remember, the urine will be going in the deep perineal pouch, paravesical space around the urinary bladder, and yes, of course, in the retropubic space. That is nothing but the space of Ridgius. Yahan jayega. Makes sense. Is it okay? Yes. So first of all, you try to learn here like this, sir. Let us just try to make some notes here. If in the exam, they are going to mention this word, this is pelvic fracture, then remember which urethra will be involved here, sir. It is going to involve the membranous urethra. Membranous urethra will be ruptured. And if this membranous urethra will be ruptured, sir, then urine kahan extravasate hoga, where all the urine is going to get extravasated. Remember, the urine will go into the deep perineal pouch, and it will also go into the paravesical space. Apart from that, yes, the space of Ridgius. Okay, the space of Ridgius. Okay. So deep perineal pouch, the paravesical space, and the space of Ridgius. Wahan par ja sakta hai. Is it okay? But one important thing that you have to remember, I'll tell you the MCQ here itself, like NEET PG mein jo option diya gaya tha. Remember, it cannot go into the peritoneal cavity. First, let me show you the picture. Yes, the urine will be going here. Let me just spoil this diagram here, sir. So urine yahan par jayega, this all this space here, the paravesical space around the urinary bladder. But can this urine go into the peritoneal cavity? No, it cannot go into the peritoneal cavity. Absolutely no, sir. So please mention that one also. Okay, na? So it cannot go. Okay. Not in peritoneal cavity, sir. I'm just giving you the notes in short. You can write down the complete things here, sir. तो आपको ना साथ साथ में ये भी याद रखना होगा कि यूरिन कहाँ जाएगा और कहाँ नहीं जाएगा. They're asking the questions like many a times in the exam. So let us get ready for everything, sir. Understanding your point here. So urine will be going in the deep perineal pouch, in the paravesical space around the urinary bladder, around the vesicle, as well as the space of Bridges, but not in perineal cavity, peritoneal cavity. No way, no way in the peritoneal cavity. So why I'm giving you this option here, sir? Why? Because in the exam, they're asking this type of question only. Urine will go in all the spaces except one. So you can actually save your time there. The moment you see membranous urethra, pelvic fracture, it cannot be in the peritoneal cavity. That's all. You can save your time there, sir. Understanding? So you just look for the keywords. अगर आप ये words देखोगे ना, keywords. Okay. The moment you see the pelvic fracture, it will be membranous urethra. Yes, it cannot go in the peritoneal cavity. It will go in everything else, sir. Is it okay? Something like that. You can save your time in the exam, sir. Now, welcome to the next one here, sir. The next concept. Is it okay, sir? Very clear with this one here? Just give me a thumbs up if you're clear with this concept here. अगर ये वाला concept clear हो गया है, तो then I'll go for the straddle injury, sir. Is this very clear? Now, once you're clear with this one here, yes, let me just remove all these things. Let us take the case number 2. Second case here, sir. The case number 2 here will be the straddle injury, sir. Straddle injury, a person is riding a bicycle on a bumpy road. Straddle injury diya jayega. The moment you see this keyword here, straddle injury, yes, there will be rupture of which urethra? Bulbar urethra. Crystal clear concept. Thank you, thank you, thank you. Thank you, Dr. Manan. Thank you, Dr. Sophie. Next one, sir. Straddle injury में which urethra will be ruptured, sir? Bulbar urethra will be ruptured. Now, I told you just now here that what is this perineal pouch? This one will be the superficial perineal pouch. So urine will extravasate out into the superficial perineal pouch. Okay, ji. The urine will also go into the scrotum here. Okay, ji. Then the urine will also go into the penis here, sir, the shaft of the penis here. Okay, the penile shaft. And apart from that, the urine can also extravasate into the anterior abdominal wall. That fascia is continuous over there. Oh my God. Understanding? So this is very dangerous. So it's going into the anterior abdominal wall, and it will be going almost up to the axilla also, sir. So you have to be like very careful with these kind of injuries here. Okay. So bulbar urethra agar rupture hoga, the urine will be going out in superficial perineal pouch, into the scrotum, into the penile shaft, as well as the anterior abdominal wall, sir. Is it okay? Next one. So let us just make a note here. So what is the key word, my dear friends, here? The key word that you have to look in the clinical question is that straddle injury. Straddle injury. And the moment you see a straddle injury, without any doubt, which urethra will be ruptured, sir? Bulbar urethra will be ruptured. There will be rupture of bulbar urethra, sir. ठीक है ना? और अगर bulbar urethra rupture होगा, तो urine कहाँ जाएगा? Where will the urine extravasate? The urine will be extravasating into the superficial perineal pouch. Okay. The urine will go in the scrotum. Okay. The urine will also extravasate into the penis, the penile shaft, as well as the urine will go into the anterior abdominal wall. I hope now it is very clear. The urine will extravasate out into the superficial perineal pouch. It will go into the scrotum and it will go into the penis as well as into the anterior abdominal wall. ठीक है? अब जैसे मैंने आपको कहा है, as I told you people here, yes, as I told you people here, my dear friends, can not only you have to learn about where the urine is going, as well as please be ready in the exam for where the urine cannot go. Urine कहाँ नहीं जा सकता है, ठीक है ना? तो in this, I want you to just add in your notes there, sir. अगर ये bulbar urethra rupture होगा, if this bulbar urethra is ruptured, sir, okay, I told you where the urine is going, but remember, urine cannot go into the deep perineal pouch. Makes sense? वो तो मुझे बताने का जरूरत ही नहीं. I don't even have to tell you. It cannot go into the deep perineal pouch. It will be going in the superficial perineal pouch. It cannot go into the deep perineal pouch. Why? Why it cannot go into the deep perineal pouch, sir? Why? Because it is prevented by this membrane. और मैंने आपको बताया था what is the name of this membrane? Perineal membrane. That word is very commonly used in the exam. So what is that membrane? Perineal membrane. It cannot go there. And one more important thing is that I hope you all have heard about the ischiorectal fossa. Ischiorectal fossa or ischioanal fossa करके होता है, ठीक है ना? So ischiorectal fossa or ischioanal fossa वो वहां पर नहीं जा सकते. It cannot go, sir. And right now in our this session here, in the clinical Thursday session of doc tutorials here, I'm not going to go into the ischiorectal fossa and all those things right now. So let's not deviate from our topic right now. ठीक है ना? मैं आपको किसी और सेशन में पढ़ाऊंगा. तो for now you just remember it cannot go there. It cannot go there, sir, because that was mentioned in the options. ठीक है ना? So remember, the urine cannot go into the ischiorectal fossa. Okay, not in ischiorectal fossa. Ischiorectal fossa. ठीक है? It cannot. Here, obviously, it cannot go into the deep perineal pouch. वो तो common sense है. It's like common sense there. I think I don't even have to mention that one. Until and unless perineal membrane is also ruptured, तो वो deep perineal pouch में तो नहीं जाएगा. Apart from that, most important thing is it cannot go into the ischiorectal fossa. That's important, sir. Is it okay? So I think I have made the concept like crystal clear here, sir. You have to search for the keywords. So in the exam, if they give you straddle injury, definitely bulbar urethra will be ruptured. Or agar bulbar urethra rupture hoga, I have shown you very, very clearly in the diagram there, where will the urine extravasate out. Is it okay, my dear friends? Now, once you have understood these two concepts here, sir, the extravasation of urine, okay, membranous urethra and bulbar urethra. Now, let me ask you one question here. Let me ask you one question here, sir. Now, instead of mentioning, pelvic fracture, or instead of mentioning the straddle injury, यहाँ से तो my students are completely ready right now, है ना? मेरे students तो completely ready है. They are ready about, how to handle this question now. कि yes, Azam sir ने आपको बड़ा clearly बता दिया है. Pelvic fracture, membranous urethra, straddle injury, bulbar urethra, है ना? You are ready with this one. Now, just to torture you in the exam, just to twist the question in the exam, if I ask you one question here, sir, just tell me the answer, then we'll wind up this session here, sir. By that, I can understand that you got my concept. आपको समझ में आ गया concept, ठीक है ना? So instead of giving you these two words, they will be actually twisting the question. In one of the clinical case in the exam, it was mentioned that urethra is injured above the perineal membrane. There is an injury of urethra above the perineal membrane. So my dear doctors, all of you listening to my class from the last 30 minutes, can you please tell me if this word is given, then which urethra is gone? Which urethra is ruptured? Which urethra is ruptured, sir? Above the perineal membrane. Come on. Above the perineal membrane, which urethra will be ruptured, sir? I'm waiting for your answer there. Excellent. Excellent. Excellent, Dr. Manan. Excellent, Dr. Vikas. Excellent, Dr. Faizan. Yes. Instead of giving that, straddle injury and all, if they mention this word perineal membrane ke upar, so definitely which one? Yes. Membranous urethra will be ruptured. अब समझ में आ रहा है, sir? So I'm just, completing the class जहां से हमने start किया था. Okay, na? It's like the circle of life, है ना? Yes, Dr. Sana, thank you. Very nice. Dr. Osama, very good, है ना? तो मैंने जहां से स्टार्ट किया था मैं, अब समझ में आ रहा है आपको? आर यू अंडरस्टैंडिंग हियर? यस डॉक्टर फैजी, वेरी नाइस. यस यस यस. तो अब मैं आपको बताता हूँ डिफरेंस. जहां से हमने स्टार्ट किया था वहीं पर खत्म कर रहे हैं, सर. जहां से हमने शुरू किया था. यस डॉक्टर सुमन, वेरी गुड, वेरी नाइस. Actually what will happen, the people who are actually preparing, the people who are actually preparing from those one-liners, and the people who are actually preparing only from the chanting sessions and all, the people who are actually preparing only from the rapid revision and all, wo kya karte hain, sir? What they will be doing? What they'll be doing? Yes, they'll be just remembering those two words, straddle injury and pelvic fracture. Straddle injury, pelvic fracture. Ab आपका एग्जामिनर क्या करता है अचानक से, नो स्ट्रैडल इंजरी, नो पेल्विक फ्रैक्चर, ये वर्ड यूज ही नहीं करता है. ही इज नॉट गोइंग टू यूज दैट वर्ड. इंस्टेड ऑफ दैट, दैट एग्जामिनर विल गिव यू above the perineal membrane. And which students can answer that question? Only those students who have attended the complete lecture, conceptual lecture. Understanding my point here, sir? Are you getting my point here? So that's the difference between just reading like one-liners and reading in between the lines. Understanding, my dear friends? I think जहां से हमने शुरू किया था हम वहीं पर खत्म कर रहे हैं सर. तो मैंने आपको यहाँ प्रूव भी कर दिया है. In the class I have proved you here. Yes, in the class I have proved you here why it is very much important to learn like conceptually, sir. Conceptually पढ़ना कितना जरूरी है. अब समझ में आ रहे हैं? तो अचानक से क्या होता है, अरे यार स्ट्रैडल इंजरी नहीं था, पेल्विक फ्रैक्चर नहीं था, अचानक से द स्टूडेंट्स विल बी लाइक अरे सर आपने तो पढ़ाया ही नहीं है, आपके नोट से कुछ नहीं आया है सर, है ना, दिस दैट एंड ऑल. भाई साहब, यू हैव टू एक्चुअली गिव सम टाइम and attend the complete class, then only you can actually understand the questions which are giving nowadays in the exam, sir. आजकल आपके एग्जाम में जो सवाल आ रहे हैं ना, especially in the FMG exams and all, the questions which are asked, yes, this is how they are asking, sir. So concept we are learning, guys, concept we are learning, but remember how to apply that, you can learn that only in the full complete lecture. Understanding? So I request all the students with the folded hands, sir. I'm not ordering here. I'm requesting all of you with the folded hands here. Please, my dear friends, attend the complete lecture. Okay. Yes, you can find all the detailed lectures in our doc tutorials platform. I have, taught the entire anatomy very clearly in detail in the doc tutorials lecture, sir. So I request all of you people to attend that and then see the changes in you and see your results, sir. आपका result देखिए वहां पर, ठीक है ना? Blaming others and writing on the social media platforms is like damn easy, and I have proved that within 30 minutes. What is the difference, sir? How they'll be asking the question, guys? Is it okay? So I think this session has actually helped you also. Sir, एक बार short में जुलाई FMG के recall questions बताओ, sir. Dr. Vikas will be actually doing a complete session. Yes, I have already prepared the questions. Questions are ready with all the options. Actually, I'm not in a hurry to do the recall session, Dr. Vikas. मैं ना जल्दबाजी नहीं कर रहा हूँ, क्योंकि जल्दबाजी में क्या होता है, like we are not able to form the complete questions. Complete framing नहीं होता है, proper options नहीं होते हैं. तो basically what I am doing is I am in contact with certain doctors, yes, and I'm thankful to them on the platform here. I'm thanking them. They're trying to help me with the exact language of the question, exact options also, to whatever extent possible. So I'll be doing it like probably tomorrow or day after tomorrow. I'll be doing the recall session. Don't worry about that one. Is it okay? So हम लोग exactly करते हैं ना, खाली बस जल्दबाजी में ऐसे क्यों बताएंगे, है ना? तो let me try to bring as much close questions as possible to you. Is it okay? हाँ, ऑनलाइन पे मतलब बहुत सारे रिकॉल क्वेश्चंस आप देख रहे होंगे, बट आई जस्ट वांट टू ब्रिंग लाइक प्रॉपर लाइक कंप्लीट थिंग्स. ओके ना? Thank you, Dr. Faizan. Hearing you in Jasu since the last 3 years, big fan of you. Thank you, Dr. Faizan. ठीक है ना? Yes, of course, Chaudhary ji, exclusively from Jaipur here. Okay. Yes, thank you, ji. Sir, did you taking live classes for the NEET PG or next exam for the anatomy and biochemistry? Yeah, of course. I'll be taking the live classes. On doc tutorials, you can actually have both the things, like online as well as offline. Online, yes, complete app. All my videos are available there. You can watch that one. Apart from me, all the national faculties, very good faculties, very good group of faculties we have in doc tutorials here. You can attend all the lectures. Apart from that, we also have offline centers also. So offline maybe my class karta hu, so, okay na? So Dr. Real also have offline centers, like we already are operating in Hyderabad, we are operating in Delhi, and we are operating also in Trivandrum and in Calicut also. Okay na? So there I'll be taking the offline classes. Yes, already done. So okay, ji, thank you, Dr. Vikas. Thank you all for attending this session. Hope this session was useful to you guys. है ना? ये सेशन आपके लिए यूजफुल था होगा, है ना? सो जस्ट ड्रॉप योर कमेंट्स ओवर देयर इफ यू लव दिस सेशन, एंड प्लीज ड्रॉप एनी गुड सजेशंस. लेट्स बी पॉजिटिव टुगेदर, हैंड इन हैंड. लेट्स हेल्प टुगेदर. लेट्स achieve the success together, sir. Instead of pointing fingers on others, let's be together. Let's spread the positivity, sir. Instead of negativity, let's spread the positivity, guys. Okay, so saying that, thank you all, take care, bye bye, good night, sir. God bless you all.